Welcome to VerifiedRx, your prescription for success. Brought to you by the Vizient Center for Pharmacy Practice Excellence.
Clinical pharmacy optimization opportunities abound, and executing on them can be enhanced when collaborating with external partners. Dr. Nikolai Dahl, Program Manager for Medication Utilization and Formulary at John Muir Health, and Dr. Tony Huke, Senior Consulting Director at Vizient, are here with me today to share their partnership experience and the resulting successes. I'm Gretchen Brummel, your program host. Welcome back to the podcast, both of you.
Thank you. Thanks, Gretchen. Happy to be here.
Our listeners know you both very well from previous episodes, so let's get right into it. How did your partnership come about?
Our executives started to look into our medication spend in our outpatient areas. In the past, we had mostly been focused on acute care, and so that spend started to increase very quickly after acquisitions of several outpatient areas. They wanted to enlist some help for us, and that's where Tony came in.
Yeah, with the acquisition of the large physician group of clinics, we focused on streamlining and unifying practice across the various locations and formulary standardization. It's been an excellent partnership so far.
Thank you for that background. And Nikolai, when you first learned of this engagement, what were your initial thoughts?
First, since most of our engagements with Vizient previously had been more in the acute care space, I wasn't sure exactly where we could gain a lowering of cost or margin. But when we spoke with Tony and his team, we realized it was more in the outpatient margins, the outpatient spend and utilization, and our formulary management. And that really excited us because we hadn't had a strong hold on that at the time.
And Tony, what about you? When you visited John Muir Health, what were your impressions?
Believe it or not, I haven't had the opportunity yet. When this engagement started, a colleague of mine who had previous experience at John Muir was assigned to the project, but he was close to retirement. He started the project. The relationship and collegiality had already been developed by him. I was kind of following along for the first 6 to 8 weeks and then took over after the first of the year. That speaks to our ability to pivot and be flexible with our members. We can either come on site as needed. Certainly, there's some benefits to being face-to-face, but also if needed, we can conduct our work virtually and still be successful.
Well, it's great to hear about that flexibility and the seamless passing of the baton. I'm guessing you're looking forward to getting out there eventually, though.
Yeah, I want to come to Oakland and maybe spend a weekend in San Francisco and Oakland.
Sounds great. How did you work together to get started?
It took a lot of time to create a utilization list of what our medications were and the spend data. And going through that data, I think, was a little bit more complicated than it had been in the past, where we could provide one list of medications, what our utilization was, what our spend was, versus we were looking at our clinics, our specialty clinics, and then also our acute care side. Truthfully, it's been very helpful for me to pull that information together because I can use it in the future now that we have that information.
So the work has sustaining benefits.
Exactly.
The other thing that made it a little complicated is start with the different data streams. Normally, we have a nice historical spend perspective and we can look ahead. Making sure we had the correct data to make assessments and look for opportunities was important. It took a while to get it pulled and unified, but once we did, we were able to dig in and find some really good opportunities.
And how did you prioritize the to-do list?
Well, with a focus on ambulatory practice and formulary alignment, that really informed our prioritization. So we look for high value, easy to implement changes. And 2 early wins in particular were a vaccine portfolio initiative that was led by a colleague of mine, Jennifer Taylor, and also biosimilar optimization that was led by a colleague, Michelle Rice. So those were 2 of our early and high value wins.
So you mentioned some of the early wins. Nikolai, what were some that were particularly impactful to you?
One of the earliest we had was dose rounding and dose banding of a lot of our more expensive monoclonals and biologics. And that was very helpful to explain to our finance department as one of those first initiatives of why this is so impactful for our John Muir Health. In addition, we were also starting to look at more of our margins versus just cost reduction, which in the past has been something that we've only looked at reducing the cost on those cost centers in acute care.
Yeah, very impactful work. What surprised you about the engagement?
It was just getting a better handle on our outpatient utilization and the payments with really having a focus on margin and value. In the past, we've really just been focused on the acute care. So this has been a whole new mindset for us moving forward.
Sometimes when people hear about consultants coming in, there are concerns. Do you have any stories to share about how your experience was a positive one?
Both the vaccines and the biosimilars, we had a very positive response from our physicians within the committees for our vaccine committees and also our pharmacy and therapeutics committee. We were able to show the analytics that Jennifer and Michelle and Tony were able to provide us. And that really drove the point home that either we were not getting reimbursed for certain vaccines because it just wasn't within our scope at John Muir Health. And then within the biosimilars, we were not getting paid for what we were administering to those patients.
And Tony, can you tell me about a challenging initiative that you addressed?
Sure. The one that comes to mind is some work we did around the product albumin. John Muir had drafted an order set several years ago, and it got shelved temporarily through the pandemic. So we picked up the work they had started, we updated it, developed a whole new order set. I had to take it to P&T for approval, then staff education, then the IT and infrastructure changes needed. And so while it has been impactful, like many instances or many organizations, that change wasn't as swift as we had hoped it to be, but it's in place and providing value. So great job by the John Muir team.
Yeah, albumin is one of those that's really challenging to address based on the diversity of indications and patient populations. So I'm glad to hear you were successful there. Anything else to add?
I'd just like to thank Nikolai in particular and his leader, Martin. They've been wonderful partners throughout the engagement, wonderful to work with and really easy. And they have become colleagues and friends and appreciate the work that they've done with us.
Yeah, and we really appreciate Tony, Michelle, and Jennifer for really guiding us to success in so many of these initiatives.
Well, thank you both so much for joining us today to share your partnership and your collaboration. I'm really glad that you could be here.
Thanks, Gretchen.
Thanks, Gretchen.
And listeners, please join us for more VerifiedRx podcasts. Subscribe today, like us, and send us your comments. We'd love to hear from you. VerifiedRx is your prescription for success and is brought to you by the Vizient Center for Pharmacy Practice Excellence. I'm Gretchen Brummel. Thanks for listening.